Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 30 practice questions. With out the way, let's get started.
The client is diagnosed with low back pain and is prescribed cyclobenzaprine. Which instructions should the clinic nurse teach the client? Select all that apply. 1. Take the medication just before leaving home for work each day. 2. Drink a full glass of water with each dose of medication. 3. The medication can cause drowsiness that will make driving unsafe. 4. Divide the dose of medication between early morning and bedtime. 5. Suck on hard candy if you experience a dry mouth. The correct answers are 3. The medication can cause drowsiness that will make driving unsafe, and 5. Suck on hard candy if you experience a dry mouth. Cyclobenzaprine is a muscle relaxant. The medication acts on the central nervous system and can cause drowsiness. The client should be warned not to drive until the client understands the effects on his or her body. Driving could be dangerous for the client and others. Taking the medication before leaving the house could be a danger to the client and others because this medication can cause drowsiness. The client should not be driving or operating equipment until the client has determined the effect of the medication on his or her body. There is no need to drink a full glass of water when taking cyclobenzaprine. A side effect of cyclobenzaprine is a dry mouth, so using hard candy is an appropriate intervention. The charge nurse on an orthopedic unit is transcribing orders for a client diagnosed with back pain. Which HCP order should the charge nurse question? 1. Physical therapy for hot packs and massage. 2. Complete blood count and complete metabolic panel. 3. Hydrocodone PRN. 4. Carisoprodol POBID. The correct answer is 3. Hydrocodone PRN. Hydrocodone is an opioid analgesic. This medication order is incomplete. The nurse should contact the HCP for a time limitation. Physical therapy for heat and massage is standard therapy for back pain. There is no reason to question this order. For option 2, many medications can affect the kidneys or the liver and the blood counts. Baseline data should be obtained. There is no reason to question this order. Carisoprodol is a muscle relaxant and comes in one strength, so this order is complete. There is no reason to question this order. The nurse is administering medications to clients on an orthopedic unit. Which medication should the nurse question? 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. 2. Morphine to a client diagnosed with back pain rated as 6. 3. Methocarbamol to a client diagnosed with chronic back pain. 4. Acetaminophen with codeine 3 to a client diagnosed with mild back pain. The correct answer is 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. Ibuprofen is an NSAID. NSAIDs decrease prostaglandin production in the stomach, increasing the client's risk of developing ulcers. This client has a known risk of peptic ulcer disease. The nurse should question the medication and discuss this with the HCP. Morphine sulfate is an opioid analgesic. Opioid analgesics are administered for pain. The client is in the moderate to severe pain range. The nurse would administer this medication. Methocarbamol is a muscle relaxant. Muscle relaxant medications are administered to clients with back pain to relax the muscles and decrease the pain. The nurse would administer this medication. Acetaminophen is a non-narcotic analgesic, and when combined with codeine, a narcotic analgesic, the potency of medication for pain relief is increased. The nurse would administer this medication. The client diagnosed with low back pain is prescribed morphine sulfate. Which interventions should the nurse implement? Select all that apply. 1. Discuss with the HCP starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. 3. Inform the client to rise quickly from a supine position. 4. Administer anticonvulsant medications around the clock. 5. Tell the client to call for assistance when getting out of bed. The correct answers are 1. Discuss with the HCP, starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. And 5. Tell the client to call for assistance when getting out of bed. Narcotic pain medications slow peristalsis in the small and large intestines, increasing the risk for constipation and fecal impaction. The nurse should discuss a bowel regimen with the HCP. The nurse should attempt to have the client quantify the pain so that the effectiveness of interventions can be evaluated. The numeric pain scale is one method of objectifying the pain. Rising quickly from a flat-on-the-back position could increase the client's pain. Some of the medications administered for back pain can cause orthostatic hypotension. The nurse should teach the client to turn on the side and push up on the elbow slowly when getting out of bed. The client may be taking antispasmodic and pain medications, but there is no reason for anticonvulsant medications. For option 5, tell the client to call for assistance when getting out of bed. The client diagnosed with low back pain is scheduled to have a steroid injection into the intrathecal space. Which statement by the client indicates the client understands the procedure? 1. I will have to curl up like a Halloween cat. 2. This procedure will cure my back pain. 3. I will have an injection in each of my hips. 4. There is no risk with this procedure. The correct answer is 1. I will have to curl up like a Halloween cat. Intrathecal indicates into the central nervous system via a lumbar puncture. The client will be positioned with the back arched, much like a Halloween cat, for the HCP to be able to insert the needle between the vertebrae. The procedure provides temporary relief of inflammation of affected nerves. The injections are into the intravertebral space, not into the hips. An injection in the hips indicates an intramuscular injection. There is risk with any procedure. In this procedure, nerve damage is the greatest risk. The nurse is completing the preoperative checklist for a client diagnosed with a herniated disc. Which information is a priority for the nurse to notify the operating room staff? 1. The client is reporting a headache. 2. The client is allergic to iodine and aspirin. 3. The client has not had anything to drink. 4. The client's hematocrit is 43%. The correct answer is 2. The client is allergic to iodine and aspirin. The standard surgical scrub is a povidone iodine antiseptic skin preparation. This should be brought to the attention of the surgical nurse who will be preparing the surgical site so that a substitute can be used. The client's report of a headache occurs frequently when clients have not been able to eat or drink, especially caffeine drinks. This is not a priority at this time. Clients going to surgery should be NPO for several hours to prevent aspiration during anesthesia. Option 4 is a normal hematocrit level. The client presents to the outpatient clinic reporting back pain. Which assessment question should the nurse ask first? 1. What activity did you do to hurt your back? 2. Which over-the-counter medications have you taken? 3. Have you used illegal drugs to treat the back pain? 4. Did you miss any work time because of this pain? The correct answer is 2. Which over-the-counter medications have you taken? The priority at this time is to determine what medications have been tried in order to assess the full extent of the injury. This is the first intervention. Adult clients will frequently only seek the HCP's advice and treatment when remedies have failed. Option 1 is important, but it is not a priority during the initial assessment. The nurse should determine how the client has been treating the injury. This would be the second query, not the first. Option 3 is an accusatory statement and most likely will make the client mistrust the nurse's objectives. This should not be asked at this time. Option 4 is the third query the nurse could ask. Missed work time is important, but to treat the client, the HCP must be aware of the attempted treatments. The client diagnosed with chronic low back pain has been taking baclofen. Which instruction should the nurse review with the client? 1. The medication can cause gastric ulcer formation. 2. The client may consume no more than 1 glass of wine per day. 3. The medication must be tapered off when discontinued. 4. The client should not take the medication before bedtime. The correct answer is 3. The medication must be tapered off when discontinued. Baclofen must be tapered off when being discontinued. Abrupt withdrawal after prolonged use can cause anxiety, agitated behavior, hallucinations, severe tachycardia, acute spasticity, and seizures. This medication is not known to increase the risk of ulcers. The client should be warned not to consume any alcohol while taking baclofen. Baclofen is a central nervous system depressant, as is alcohol. The combination of alcohol and baclofen could intensify the depressant effects. The medication can cause drowsiness, which might assist the client to rest. Administration at bedtime is preferred if this is the case. The nurse is administering 9 o'clock medications to clients on a medical unit. Which medication should be administered first? 1. Morphine sulfate extended release to a client with low back pain. 2. Chlorzoxazone to a client on bed rest. 3. Acetaminophen to a client with a headache. 4. Diazepam to a client with muscle spasms. The correct answer is 4. Diazepam to a client with muscle spasms. Diazepam is a benzodiazepine. A client having muscle spasms is a priority for the nurse. Muscle spasms can be extremely painful. This medication should be administered first. Morphine sulfate extended release is an opioid analgesic and is a sustained-release tablet. This medication is to provide relief of chronic pain over the course of the day. It does not need to be the first medication administered. Chlorzoxazone is a muscle relaxant. The client prescribed bed rest usually takes a muscle relaxant as a routine medication. It does not need to be administered first. Acetaminophen is an analgesic. A headache that is to be treated with acetaminophen would not be the first medication for the nurse to administer. The client is admitted with severe low back pain and prescribed methocarbamol IV piggyback every 8 hours. Which nursing intervention has priority when administering this medication? 1. Ask the client to lie flat for 15 minutes following the IV infusion. 2. Infuse at a rapid rate of 200 to 250 milliliter per hour via an infusion pump. 3. Assess the IV site for extravasation after the infusion is complete. 4. Monitor liver function laboratory tests daily. The correct answer is 1. Ask the client to lie flat for 15 minutes following the IV infusion. Methocarbamol is a muscle relaxant. The client should be kept recumbent during and for at least 15 minutes following the administration of methocarbamol IV to reduce the risk of orthostatic hypotension. The medication must be administered slowly at a rate of no greater than 300 milligrams per minute, not by rapid infusion. The IV site should be assessed prior to the initiation of the medication to prevent complications from extravasation of the medication into the tissues. Methocarbamol is detoxified by the kidneys, not the liver. The client diagnosed with osteoarthritis is prescribed celecoxib. Which statement by the client warrants intervention by the nurse? 1. I take aspirin daily to help prevent heart disease. 2. I am allergic to penicillin and aminoglycosides. 3. I know I am overweight and need to lose 50 pounds. 4. I walk 30 minutes at least 3 times a week. The correct answer is 1. I take aspirin daily to help prevent heart disease. Celecoxib is an NSAID. The client should not take aspirin with an NSAID because it can increase the risk of gastrointestinal upset and possible gastrointestinal bleeding. Allergies to antibiotics are not a contraindication to the use of NSAID. Obesity is not contraindicated in clients taking NSAIDs. Exercising is recommended for clients with osteoarthritis unless it causes pain. Therefore, this activity would not warrant the client not taking celecoxib. The client diagnosed with severe osteoarthritis of the left knee is receiving sodium hyaluronate injected directly into the left knee. Which information should be discussed with the client? 1. Explain that this medication will cause some bleeding into the joint. 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. 3. Discuss that the medication will be injected daily for 7 days. 4. Tell the client that strict bed rest is required for 24 hours after the injection. The correct answer is 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. Sodium hyaluronate is a synovial joint lubricant used for relief of osteoarthritis pain unrelieved by NSAIDs. After the injection, the client can walk and perform routine daily activities, but running, bicycling, or strenuous activity should be avoided. Sodium hyaluronate is a preparation of a chemical normally found in high amounts in the synovial fluid. The injection replaces or supplements the body's natural hyaluronic acid that deteriorates as a result of the inflammation of osteoarthritis. Any bleeding into the joint is a complication. Bleeding into a joint would not be the expected benefit of any type of medication. The treatment includes 3 to 5 injections, with the client receiving 1 injection every week. This injection is done in an HCP's office. The client will be able to walk out of the clinic after the injection. The nurse is preparing to administer the following medications. Which medication should the nurse question administering? 1. Ibuprofen to a client receiving furosemide. 2. Nabumetone to a client receiving digoxin. 3. Acetyl salicylic acid to a client receiving warfarin. 4. Ketorolac intramuscularly to a client on morphine. The correct answer is 3. Acetyl salicylic acid to a client receiving warfarin. Acetyl salicylic acid is a mild analgesic, but it is also an antiplatelet. Acetyl salicylic acid displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should question administering the acetyl salicylic acid. Ibuprofen is an NSAID. NSAIDs do not interfere with the effectiveness of loop diuretics. Therefore, the nurse would not question administering the ibuprofen. Nabumetone is a cyclooxygenase 2 inhibitor. Cyclooxygenase 2 inhibitors do not interfere with the effectiveness of cardiac glycosides. Therefore, the nurse would not question administering the nabumetone. Ketorolac is an NSAIDs. Ketorolac is often administered around the clock to a client in pain, along with a narcotic analgesic. Ketorolac decreases the inflammation to help decrease the pain. The client is taking acetyl salicylic acid 4 to 5 times a day for severe osteoarthritic pain. Which teaching interventions should the nurse discuss with the client? Select all that apply. 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl salicylic acid. 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. 5. Explain that ringing in the ears is a common side effect. The correct answers are 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl salicylic acid. And 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. Alcohol displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should instruct the client not to drink alcohol. Acetyl salicylic acid poisoning can kill children, and all medications, prescription or non-prescription, should be kept out of the reach of children. High doses of acetyl salicylic acid can cause bleeding. Therefore, the dentist should be made aware of the client's medication use. Aspirin toxicity can occur when the client is taking acetyl salicylic acid 4 to 5 times a day. Therefore, the serum level should be kept within normal limits. Mild toxicity occurs with serum levels above 30 milligrams per deciliter, and severe toxicity occurs above 50 milligrams per deciliter. Tinnitus is a sign of aspirin toxicity and should be reported to the HCP. At 9 o'clock, the charge nurse observes the primary nurse crushing an enteric-coated aspirin in the medication room. Which action should the charge nurse implement? 1. Take no action because this is an acceptable standard of practice. 2. Correct the primary nurse's behavior in the medication room. 3. Explain that enteric-coated medication should not be crushed. 4. Complete an adverse occurrence report on the primary nurse. The correct answer is 3. Explain that enteric-coated medication should not be crushed. The charge nurse should explain to the primary nurse that enteric-coated aspirin should not be crushed because the coating ensures the aspirin will dissolve only in the small intestine where the coating dissolves. The aspirin will be absorbed in the stomach if the coating is crushed. Enteric-coated aspirin should not be crushed. The charge nurse should not correct the primary nurse in front of other staff, and, at 9 o'clock, there would be other nurses in the medication room. Because the client did not receive the crushed enteric-coated aspirin, no adverse occurrence report needs to be completed. This form is completed if the client's condition has been compromised in some way. The client diagnosed with a partial thickness burn is prescribed mafenide acetate. Which intervention should the emergency department nurse implement when applying this medication? 1. Do not administer if the serum sodium level is decreased. 2. Assess the client's urine for any increased concentration. 3. Determine the amount of burned skin using the rule of 9. 4. Pre-medicate the client prior to administering the medication. The correct answer is 4. Pre-medicate the client prior to administering the medication. Mafenide acetate is a topical antimicrobial. The medication causes pain or a burning sensation following its application. Therefore, the client should be pre-medicated. The serum sodium level is not affected by mafenide acetate, a topical antimicrobial. It is affected when administering silver nitrate, a topical antimicrobial that is also used to treat burns. Urine concentration may be affected by silver sulfadiazine, a topical antimicrobial that is used to treat burns, but mafenide acetate does not affect urine concentration. This should have been done prior to the emergency department's physician prescribing this medication. Therefore, this would not be an appropriate intervention. The nurse is discussing the application of silver nitrate to a client diagnosed with a partial thickness burn to the left leg. Which information should the nurse teach the client when discussing how to apply this medication after discharge? 1. Administer the silver nitrate ointment directly to the burned area twice a day. 2. Notify the HCP if a black discoloration occurs on the burned area. 3. Apply the silver nitrate solution to the wound dressing every 2 hours. 4. Do not allow anyone except the HCP to change the wound dressing. The correct answer is 3. Apply the silver nitrate solution to the wound dressing every 2 hours. Silver nitrate is a topical antimicrobial. Silver nitrate is used as a 0.5% solution in distilled water and should be applied to the bulky gauze dressing every 2 hours, and the dressing should be changed twice a day. Option 1 is the incorrect way to apply silver nitrate. Silver nitrate solution causes a black discoloration on all skin surfaces and dressings with which it comes into contact. Therefore, the client would not need to notify the HCP. The bulky wound dressing must be changed twice a day. Therefore, the nurse must teach the client to change the dressing. A dressing change does not have to be done only by the HCP. The client diagnosed with a full thickness burn over 38% of the body is admitted to the burn unit 4 hours after the fire. The HCP writes an order for Ringer's lactate, 450 milliliter per hour. Which interventions should the nurse implement? Select all that apply. 1. Question the HCP's orders. 2. Administer the IV fluid as prescribed. 3. Infuse the IV fluid via a pump. 4. Do not administer more than 200 milliliter an hour. 5. Verify the order with another nurse in the burn unit. The correct answers are 2. Administer the IV fluid as prescribed, and 3. Infuse the IV fluid via a pump. There are formulas that are used to determine the client's fluid volume resuscitation. The formulas specify the total amount of fluid that must be infused in 24 hours, 50% in the first 8 hours, followed by the other 50% over the next 16 hours. This is a large amount of fluid, but its administration is not uncommon in clients diagnosed with full thickness, burns over more than 20% of their total body surface. The IV fluids must be infused on a pump to ensure the client receives the correct amount for fluid resuscitation. For option 1, the nurse should administer this IV fluid as ordered. For option 4, this is not an unusual amount of fluid to be infused. There is no absolute amount of fluid that a client may require during fluid resuscitation. For option 5, there is no reason to verify this order with another nurse in the burn unit. The client experienced an electrical burn that resulted in full thickness burns to the right and left hand. The HCP ordered the fluid resuscitation rates. Which data indicates the fluid resuscitation is effective? 1. The client's urine output is less than 30 milliliter per hour. 2. The client's urine output is at least 50 milliliter per hour. 3. The client's urine output is 75 to 100 milliliter per hour. 4. The client's urine output is greater than 200 milliliter per hour. The correct answer is 3. The client's urine output is 75 to 100 milliliter per hour. The client diagnosed with an electrical burn should have a urine output of 75 to 100 milliliter per hour for the fluid resuscitation to be effective. An output of greater than 100 milliliter per hour would indicate the client is losing too much fluid and that the fluid resuscitation is not effective. Urine output of less than 30 milliliter per hour would not indicate the fluid resuscitation is effective. For option 2, this would indicate effective fluid resuscitation for a client diagnosed with a thermal burn, but not for a client diagnosed with an electrical burn. The client is admitted to the emergency department diagnosed with a partial and full thickness burn to the left leg. Which question is most important for the nurse to ask the client? 1. When was your last tetanus shot? 2. Can you tell me how this burn happened? 3. Will you need any help when you go home? 4. Have you taken any antibiotics in the last week? The correct answer is 1. When was your last tetanus shot? A tetanus toxoid is administered intramuscularly early in the acute phase of burn care to prevent Clostridium tetani infection. If the client has not had a tetanus shot within the last 10 years, or if the time is in doubt, a booster of tetanus toxoid should be administered. The client diagnosed with a partial thickness burn to the entire right leg who is being treated with silver sulfadiazine develops leukopenia. Which medication should the nurse expect the HCP to prescribe? 1. Discontinue the silver sulfadiazine ointment immediately. 2. Continue administering the silver sulfadiazine ointment. 3. Administer aminoglycoside antibiotics intravenously. 4. Administer hydrocortisone cream to the burned area. The correct answer is 2. Continue administering the silver sulfadiazine ointment. Silver sulfadiazine is a sulfonamide antibacterial agent. Many clients develop marked leukopenia in response to silver sulfadiazine. The leukopenia will improve spontaneously over the course of treatment. Leukopenia does not contraindicate use of this medication. Leukopenia improves over the course of the treatment with silver sulfadiazine and does not warrant discontinuing the medication. Leukopenia, secondary to silver sulfadiazine therapy, does not warrant the administration of aminoglycoside antibiotics. Hydrocortisone cream does not treat leukopenia secondary to silver sulfadiazine. Which client should the nurse use caution with when applying mafenide acetate to a burned area? 1. A client with a creatinine level of 0.8 milligrams per deciliter. 2. A client diagnosed with chronic obstructive pulmonary disease. 3. A client with a pulse oximeter reading of 95%. 4. A client diagnosed with type 2 diabetes who is taking insulin. The correct answer is 2. A client diagnosed with chronic obstructive pulmonary disease. Mafenide acetate is a topical antimicrobial. Mafenide acetate impairs the renal mechanism involved in the buffering of the blood, thereby increasing the excretion of bicarbonate in the urine. When this occurs, the pulmonary system effects a compensatory hyperventilatory status to maintain normal acid-base balance. If this compensation cannot take place as a result of pulmonary disease, the client develops metabolic acidosis. Mafenide acetate affects the acid-base balance in the body and should not be administered to clients diagnosed with renal disease. A 0.8 milligrams per deciliter serum creatinine level is within normal range of 0.5 to 1.5 milligrams per deciliter. Therefore, the nurse would not need to use caution with this client. This client has adequate respiratory status. Therefore, the nurse would not need to use caution with this client. There is no reason a client diagnosed with diabetes could not be prescribed mafenide acetate. The client diagnosed with partial and full thickness burns to 35% of the body is admitted to the burn department. The HCP has prescribed famotidine. Which statement best describes the scientific rationale for administering this medication? 1. Famotidine acts on the cell wall to prevent bacterial growth. 2. Famotidine will help control the client's pain. 3. Famotidine will help decrease the client's nausea and vomiting. 4. Famotidine will help decrease gastric acid production. The correct answer is 4. Famotidine will help decrease gastric acid production. Curling's ulcer is an acute ulceration of the stomach or duodenum that forms following a burn injury. Histamine 2 antagonists like famotidine are administered to decrease gastric acid secretion in the acute phase of burn care. Silver sulfadiazine, a topical antimicrobial, not famotidine, acts on the cell membrane and cell wall of susceptible bacteria and binds to cellular DNA. IV opioid medications, not famotidine, will help decrease the client's pain. Antiemetics, not famotidine, will help prevent the client's nausea and vomiting. The HCP prescribed morphine 2 to 5 milligrams intramuscular every 2 hours for the client diagnosed with full thickness, burns to the chest and abdominal area. The client reports pain of 10 on a pain scale from 1 through 10. Which intervention should the nurse implement? 1. Administer 5 milligrams of morphine IM to the client immediately. 2. Contact the HCP to request an increase in the medication. 3. Request a patient-controlled analgesia pump for the client. 4. Assess the client for complications and then administer the medication. The correct answer is 3. Request a patient-controlled analgesia pump for the client. The client should have IV pain medication until hemodynamic stability and unimpaired tissue perfusion return. The PCA pump provides an IV route, and the client can control the amount of medication administered with the PCA, ensuring safe limits of pain medication. The client should receive IV medication, not IM medication. Therefore, the nurse should not administer this medication after assessing the client. The nurse should be a client advocate and notify the HCP for a change in the route of the morphine. The client is prescribed silver sulfadiazine for a partial thickness burn to the back. Which information should the nurse discuss concerning this medication? 1. Encourage the client to drink 3,000 milliliters of water. 2. Discuss the need to eat foods high in protein. 3. Teach the client how to test the urine for ketones. 4. Instruct the client to change the dressing twice a day. The correct answer is 1. Encourage the client to drink 3,000 milliliters of water. Silver sulfadiazine is a sulfonamide antibacterial agent. The client should drink large amounts of fluids to prevent sulfa crystals from forming in the urine. The client should eat foods high in protein for healing purposes, but this does not specifically concern this medication. Ketones are a byproduct of fat breakdown and would not be specific for teaching about silver sulfadiazine. The client should change the dressing twice a day, but this is not part of teaching about the medication silver sulfadiazine. The nurse is using the antimicrobial binding dressing Actisorb Silver 220 for a stage 3 pressure ulcer on the left hip area. The dressing is a combination of silver and activated charcoal. Which intervention should the nurse implement? 1. Perform the sterile dressing change twice a day. 2. Avoid cutting the dressing when applying it to the wound. 3. Pre-medicate the client with a narcotic analgesic. 4. Do not use tape to hold the secondary dressing in place. The correct answer is 2. Avoid cutting the dressing when applying it to the wound. The nurse should avoid cutting the dressing because particles of activated charcoal may get into the wound and cause discoloration. The dressing may be left in place for up to 7 days or may be changed every 24 hours, but it would not be changed twice a day. This does not allow the dressing adequate time to increase healing of the wound. The dressing change does not warrant administering a narcotic analgesic to the client. Tape should be used to hold the secondary dressing in place, or the antimicrobial binding dressing will not remain in the pressure ulcer. The male client diagnosed with a stage 4 pressure ulcer on the coccyx area is being treated with an autolytic medication for debridement and an occlusive dressing. The wife of the client asks the nurse, "Why isn't someone doing something about that foul odor my husband has?" Which statement is the nurse's best response? 1. I will contact your husband's doctor when he makes rounds. 2. The odor is secondary to an infection, and he is taking antibiotics. 3. The odor is an expected reaction to the pressure dressing. 4. I am sorry the odor bothers you. We will bathe your husband. The correct answer is 3. The odor is an expected reaction to the pressure dressing. Option 3 is an expected reaction to the pressure dressing. The foul odor is produced by the breakdown of cellular debris and does not indicate that the wound is infected. In option 1, there is no reason to contact the HCP because this is an expected reaction to the pressure dressing. In option 2, the client may have an infection and is taking antibiotics, but this is not causing the foul odor. In option 4, bathing the husband will not help the odor. Therefore, this response is not appropriate. The nurse is changing a hydrocolloid antimicrobial barrier, dressing with silver, for a client diagnosed with a stage 4 pressure ulcer. Which intervention should the nurse implement first? 1. Rinse the wound with physiologically normal saline. 2. Remove the old dressing and assess the pressure ulcer. 3. Hold the dressing in place for 5 seconds after applying. 4. Apply sterile gloves when performing the procedure. The correct answer is 2. Remove the old dressing and assess the pressure ulcer. Removing the old dressing and assessing the pressure ulcer for healing is the first intervention. The nurse should rinse the wound with physiologically normal saline, but this is not the first intervention. This dressing must be held in place for 5 seconds after applying it to the pressure ulcer. The dressing change is performed with non-sterile gloves using aseptic technique. Therefore, this is not an appropriate intervention. The nurse is caring for a client diagnosed with a stage 3 pressure ulcer. The client has a Combiderm non-adhesive, sterile, hydrocolloidal dressing. Which data indicates the dressing is ready to be removed? 1. The exudate begins to pool on the wound surface. 2. The color of the drainage changes from brown to a yellow-gray. 3. The HCP must write an order to remove the dressing. 4. The softened area is approaching the edge of the dressing. The correct answer is 4. The softened area is approaching the edge of the dressing. This dressing is an absorbent hydrocolloidal dressing that provides a moist environment, absorbs exudates, and is non-damaging to the skin. When the softened area approaches the edge of the dressing, it must be removed, and a new one must be applied. Option 1 would indicate when an alginate dressing, not a hydrocolloidal dressing, is ready to be removed. The iodosorb gel, not the Combiderm dressing, should be changed when the color changes from brown to a yellow-gray. The nurse does not need a written order from the HCP to change the dressing. The client diagnosed with a stage 2 pressure ulcer is prescribed a hydrogel dressing. Which statement indicates the client understands the teaching about the hydrogel dressing? 1. The hydrogel dressing is soothing and reduces pain. 2. It must be used because my pressure ulcer drains a lot. 3. This dressing can only be used if my wound is not infected. 4. This dressing is very difficult to apply and remove from the wound. The correct answer is 1. The hydrogel dressing is soothing and reduces pain. Hydrogels help maintain a moist healing environment, granulation, and epithelialization, and they facilitate autolytic debridement. One advantage of a hydrogel dressing is that it is soothing and reduces pain. One of the disadvantages of hydrogel dressings is that they are not recommended for wounds with heavy exudate. An advantage of using hydrogel dressings is that they can be used when infection is present. An advantage of using hydrogel dressings is that they are easily applied and removed from the wound.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.